Hi, everyone. I'm here with Dr. Nario. Dr. Nario is with Biointegrative Health Center in Reno, Nevada. Thanks for being here, Doc.
Hi, Steve. Thank you for having me again. Always a pleasure.
All right, so we're going to talk about red light therapy. If you guys are interested in learning more about what happens in health clubs, getting fit, exercise, subscribe to the channel. Also, if you want to know more about our weight loss program, you can hit the link in the description and we'll have the right nutritionist get a hold of you. As I mentioned, Dr. Nario's with Biointegrative Health Center. You can check them out online and see all the different treatments that they do. So what are the first, red light therapy seems to be the big thing right now, or a big thing right now, isn't it?
It's out there. A lot of businesses are kind of reaping a lot of income with it. So it's hot.
And like my wife has some type of red light therapy that she does back in our little workout room. It's just a light or something that she does something with. Um, so what are the different types of red light therapy?
Right. Well, Steve, there are so many of them out there, but let's probably define to our viewers what is red light therapy, right? So red light therapy is exposing the body to red or near infrared light with the goal of producing health benefits. This is, again, considerable in terms of how we apply it, and there are different factors like wavelengths that you would hear about, near, far, or mid, and also in terms of intensity, how strong it is. It depends on of course, the frequency and also the parts of the body that you want to expose to the red light. And I think one of your questions would be, how do we apply this? There's so many ways you would see it. You would see it like, as you even thought it was like a coffin. You go in there like a tanning bed and you just close yourself in there. And then also another one would be local applications, such as you putting out specific body parts where you definitely just want exposures to happen. And there's just this box. Sometimes it just flashes a light on you. It's like more of an upper body exposure. So really, it's more, the classification would be generalized exposure and also localized exposure in terms of how you can apply this. So those are I think the little pads that you're talking about a while ago that you
Yeah,
put on
okay.
just like, yeah, body parts.
So let me ask, the one that specifically hits a body part, what are the benefits of that?
Okay, so that one, again, you're probably talking about a lot of aches, pains, right? That's the most common one. And also another common one hitting body parts would be, you would see it being used on the face, which is more of aesthetics, collagen, less wrinkles. But here's the thing. Let's now go into a more medical sense on what really red light therapy has done to medical evidence. The one that really shows a lot of medical literature about it would be a lot of joint inflammation, osteoarthritis of the knee, lower back pain, neck pain, and even fibromyalgia, tendons that are aching from after a workout, rheumatoid arthritis, even headaches. So those are the proven ones. And another one would be, if you want local, you can actually put it on your head for hair growth. And this is mostly for what we call androgenic alopecia. That's why these are the more common ones, really, that has more medical evidence compared to the other claims of red light therapy. I mean, there's so many. You would hear that it's going to fix your uh, a, a fractured bone. It will accelerate that post-op healing. Not much studies on that, but again, I wouldn't see the harm on doing it.
Yeah, I guess it can't hurt, right? So if you got an issue with your elbow, arthritis or inflammation or sore, the red light, you can put it on there and that will, I guess, improve it.
Yeah, and the concept really here is to increase circulation, promote collagen formation. And the thing there, the only drawback would be these things are not cheap. You go to these spas, you go to these stores where they sell it. Yeah, sometimes they ask for an arm or a leg for it, but yes, it wouldn't harm you if you have the resources for that. It's always a good thing to do.
Yeah, because I know, like I said, my wife has one. I'm gonna have to ask her more about it. Do you do this treatment in your clinic?
So yes, we have what we call a localized, it's not like the coffin one. We have the box, and what we do there, and we use it more for example, winter time is here, seasonal affective disorder, right? We need sunlight, we need exposure to sun rays. This is an artificial box that you can use it with. And yeah, aches and pains. So it's more of a localized device that we have here, and we integrate it with so many modalities that we have in the clinic.
Hmm. Okay, so what would the benefits, I guess they would be greater if you did the one where you lay in kind of like a tanning bed. What are the benefits of that? Are they different?
Yeah, so more body surface exposure compared to just the localized ones. So you're getting a lot of this on like areas that a local one cannot, and also in a specific period of time that is faster, right? Rather than you putting it here and then putting it down there. So by you being in a coffin, boom, it's all done. But here's some drawbacks you have to make sure that you keep an eye out for. Red light is safe for any part of the body except for the retina, which is the eyes. So the eyes should be always be covered by safety glasses, or of course you should not be exposing your eyes to it, just because of course of retinal issues. So use this, as I say, if you have a medical provider in the facility where you're doing this, it's always not going to be a bad idea.
So is there any other drawbacks?
Some other drawbacks usually could be, of course, it's really fairly safe, to be honest with you. And there's just like some sunburn-like effects because it's on the skin. Really, again, this is now going into that discussion of intensity and duration. And that's why even for like the darker skin, pigmented people, they are the ones who are more susceptible to the skin irritation of red light. But overall, it's a very safe procedure. Just cover your eyes.
Wow. So what about, did you say it's going to help like with when you can't get in the sun with like vitamin D?
Again, I wouldn't put this as a replacement for sun. You know me, I'm a big natural guy. I always like my sun to be out there. But yeah, so sun, the only problem, yes, it can help, but it's not the same as the sun. You have to remember though, the sun is also sometimes going to be a little bit harmful for you if done excessively because you have UV rays there. So the sun has UV rays and also infrared light. The one that you want from the sun is the infrared light, but you cannot choose because the sun has his own mind and will give you both. So with red
Yeah,
light
there's like
therapy,
A and B, right?
right? So that's why you're isolating your infrared light only when you do the machine rather than the sun.
Very fascinating. So what have you read any research or any experience with your patients on what type of results have you seen with this?
Right. So the benefits of red light really. So let's talk about our athletes here. So for our athletes on studies, it actually has the increased cellular energy production that it claims to power up mitochondria. And also the one study that I always remember is the red light therapy increases the number of, as we call this, um, muscle strength in volleyball players who actually were doing extrinsic exercises like bicep curls and knee extensions, and this found to be beneficial for these players by doing more repetitions on their exercises. And another study that I remember are young men who did red light therapy before strength training, and this led to greater increase in muscle size and strength. But the studies are less compared to the volleyball players. But they found that in older men it didn't get that the benefit compared to the younger ones. And another study was for older women after strength training. Some of the patients did not get increased muscle strength, but muscle size actually was improved. So there's some mixed studies about this, but again, as I always tell to my patients, this is always a win in regards to whatever benefit you get, regardless of it for pain, for muscle. There's just so many unknowns still about red light therapy, but it's still worth checking out.
Yeah, because it's like you made a really good point there. It's not going to hurt you.
Yes, just
Because
don't
and I
look
know
at it.
right, except for your eyes. I know that you work with a lot of athletes at UNR, right?
Yes. So that's
Doing
why I
different
mentioned it a
things.
lot.
Is this something that you use with them, or?
Yeah, well, for the athletes, I always promote that because one of the functions of red light therapy is actually to increase energy generation. And when we talk about that, because the concept behind that is actually the activity of the cytochrome C in the mitochondria, which increases ATP production. So it stimulates that specific cytochrome in the mitochondria by the red light therapy. So of course, an increase in ATP synthesis, it leads to enhanced tissue repair, gene expression, and also enhancement and strength of these muscles and tissues that we have. And those are specific objectives of athletes. That's why it's not going to be a specific recommendation for a specific sport. It's like everything, anything involving physicality, it's always a win for red light therapy.
Yeah, and if it's going to help an athlete, why wouldn't it help someone else too, right?
And yeah, you're not going to fail some athletic tests for it. It's not going to be in your blood. You're not going to be violating any rules. So it's always going to be, again, it's not like you're jacking yourself up through your veins with something.
Right. And if and this is something people can get and do at home, right?
Yeah, it's just you just need to. Now let's go into this. So if you're going to go into that realm, I want to advise everybody on what the definitions are. So there are three types of infrared light. So this would be far, mid, and near infrared light. So let's talk about that. When you go into or using this device, you always will think that I need to see a red light. When you see a red light, that doesn't work. Infrared light should be not visible to the naked eye. So the red lights are not effective. This has to be a light that's just white, right? And also, so let's define this. The near infrared is actually around 7 to 1400 nanometers. So that's the wavelength, right? And this actually can penetrate at least 5 cm into the skin. So the near infrared is the deepest of penetrations. So this is the one that you want to use when you want to increase your mitochondria energy, collagen production, and even for anti-aging and then muscle recovery. The mid infrared is 1400 to 3000 nanometers, meaning it's now reaching the soft tissue, the joints, and the muscles. Thus, again, it's more of the deep tissue relief, detoxification processes. And the far infrared is the 3000 nanometers or 1 millimeter, which is basically the most superficial one for your skin. And this is the one that you actually will use more for, um, again, it's more for skin, like the collagen, the wrinkles. So the deeper you go, the better effects that you get. So that's why don't be faked out about, oh, I went to the red light therapy, it's all red. Probably not red light therapy.
Yeah. So infrared sauna is that?
Yes. So infrared sauna, it's like all over the place. You would see this is also another type of exposure that you're talking about. That is probably also another better comparison to the coffin like, right? But this one is a sauna. Now it's also heat,
Yeah.
accelerating that detox process for you. So that's also another way to do it. But I'm sure it's a little bit more expensive.
And of course, you're not going to see anything red in one of those saunas.
No, if you see red, run.
Yeah. All right. So, any last thoughts that you would add to this, doctor?
Yeah, so again, red light therapy is very safe, and I always have this. Now, my interest here is going to aesthetics because they do have this ability to increase dermal collagen and elastin, and the research is still starting about this. And why I like that is because being in the anti-aging world, this is something that my patients are looking for. And this is a very and it's not like you're putting Botox on your face. It's not like you're doing a facelift. It's a one of the non-invasive ways on how to help. the collagen not only for the face but also for your joints. But that's why I advocate for a lot of non-invasive procedures, and this is probably one of them that's going to be coming out in the future. And the good thing about this is in your hands. You patients can actually get some of these, and you don't have to have a provider writing this for you. You can buy good qualities out there as long as you know where to get them from.
And have you had patients excited about this that have said, "Hey, this I think I notice it's working."
Yeah. So I have a lot of patients going to these, you said the saunas, and also I have patients who bought their own home devices and actually are happy. I have a lot of mold patients who I promote this for when they actually are trying to detox mold out of their system. They just stand up in front of the mirror, as big as a mirror of a red light therapy machine, and they're just exposing themselves there for like 30 minutes. And you can do this over and over again without any harm.
Hmm. All right. Well, if you all are interested in interviews like this with doctors, personal trainers, nutritionists, subscribe to the channel. Dr. Nario, thanks for being with us.
Thank you, Steve, for having me again. It's always a pleasure, as we all know that our knowledge is your power to better health. And thank you for letting me provide you with edge on longevity and health maintenance, which I call the biological edge or the bio edge.